What are the changes that you saw in healthcare?
We were able to hear what the doctor and the conversation between the doctor and the patient in real time and transcribe in real time.
Can you take us through somebody who doesn't know anything about the field, a youngster watching you today?
Yes.
As to what is that coding all about?
To have some sort of a certification. So we need coders that are actually certified. They go through that examination process.
How often does this exam happen in India?
I think it happens about once or twice a year, if I'm not mistaken. We actually have a lot of certified coders.
So in terms of your revenue that is coming from the US or any other geography, is it based on the revenue earned?
So different processes have different types of models in terms of pricing.
What exactly is how is the AI evolved?
4 years back when we started getting into AI.
When you look at the totality of it and the way President is doing, and there is a huge disruption there also, do you think a lot of these things which are now presently happening in countries where it is expensive to maintain, like the US for example, will come back to India and to companies like you?
That's actually quite a difficult question to answer today.
Welcome to Conversations. I'm Suresh Kochatal. Healthcare is a dicey subject, but then that is because it's provided in India as a healthcare subject. But quite often, we serve international clients. We serve the US, we serve the Europe, but in a different way. And that is something that we'll talk about in today's conversation. I have with me Vanitha Datla, Vice Chairperson of Elico Healthcare, a company that specializes in revenue cycle management and everything that is associated with it. And obviously, that means she serves more of international clients than Indian ones. But we'll know more from her first, and then we will get on moving with the rest of the subject. Welcome, ma'am. Namaste.
Thank you so much.
So the obvious question to start with is, I will ask you to talk about yourself a bit, where you came from, when did you get into this industry, and of course the various titles that you held in the past, apart from your own organization.
So thank you for inviting me to this conversation. And to start off with, I come from a very conservative and an orthodox family where women's roles were not sort of meant to go outside of the house or to actually pursue a career. But I had different ambitions right from my childhood because my father's a doctor, he's a surgeon. And I actually desperately wanted to become a surgeon just like him. We had our own nursing home at our own residence. I mean, we used to live upstairs, the nursing home was downstairs.
Okay.
And he was quite a well-known name those days, both a general and an orthopedic surgeon. And I had the opportunity of also standing next to him during some surgeries during my 11th and 12th.
Okay.
Unfortunately, I didn't get through the medical entrance, and behind the scenes, my family were not really keen on me getting into any professional education, and the only goal for them was to get me married as soon as possible.
Okay.
That happened around 18, and so by then I had just joined a Bachelor of Economics. I was sort of just sailing through mindlessly, aimlessly, in fact. But I always felt that I should actually, get into the working space. So after a stint in the US where a lot more had happened, I mean, I tried to get into certain subjects that were not available here in India. And also, I think the entire lifestyle was different there. And this was, I'm talking about almost 35 years back. And while here, especially women are so dependent on family, on the male family members, this was totally different in the United States where everybody was independent, free to take their own decisions. And I liked that a lot. And I felt that I should at least start utilizing my time to do something more creative and more economically also. I wanted to become economically independent. So after I moved back, and I was still not qualified completely. I had done a part of my bachelor's here. I did part of my bachelor's in the US, but I did not graduate with a degree. So the first thing, I came back and I actually did my graduation, completed my graduation, and then I went and asked my grandfather, who by then was an industrialist, and he had a number of companies. So I actually asked him, can I join him and start working?
Okay.
This was actually taken quite by surprise by everybody because nobody expected that I would actually open my mouth and go and ask for this sort of a favor. But I think things changed. I joined my grandfather, worked with him for about 5 years in a financial services company, though he had a lot of the core manufacturing companies like cement, sanitary ware, refractories. He didn't put me in any of those. Gave me a position in the financial services company. Spent about 5 years working under him, and then I moved to my brother's company, which was again a cement company. I think apart from me, there was only one more lady. So there was no talk about gender diversity and inclusion and all these things. These were all very, very unknown at that point of time. I think I worked for almost a decade with him, and then I took a break. And at that point, my husband said, "I think you should come and join me and this group, Elico Group." So I think around in 2009, I joined Elico. And this was actually the time when Elico, being an analytical instrumentation manufacturing R&D company, had thought about diversifying. And about 25 years back, they had diversified into the healthcare sort of the document process, which was actually at that time opening up in India.
Okay.
So we were one of the very first movers, started off with medical transcription, but we didn't stop there. So we moved up the value chain and went into revenue cycle management, went into scribe. Today we are actually moving into AI. So it's been a journey of almost now 2.5 decades, and we continue to sustain in this domain. A lot of our competition has actually either been taken over or they closed down shop. So
you still survived.
We still survived. A lot of our clients also have been with us for the last 2.5 decades. So they understand that quality is also a huge concern, and sustainability. So I think we are able to provide both those to our clients.
For those of our viewers who are watching who really don't know what revenue cycle management, what coding is, and all these things, it is basically trying to get the early part of the electronic health record part of it into it. Medical transcription was another animal by itself, but that died a natural death later because a lot of tools came in to replace that. But I'm sure, ma'am, you have companies like Allscripts, GE and others and all who have different products.
Yes.
Then you have revenue cycle providers, which is basically can be a Harvard, can be UPenn or anybody for that matter. A lot of clients in the United States went electronic earlier than the Indian healthcare system did. We were late in catching up, but I think we are already catching up well there. Can you take us through a kind of evolution of this sector as you saw it, say 2.5 decades ago, and to where it is now?
So as I mentioned, started off with medical transcription, and this was actually provided as a service to the doctors and physicians who were looking at patients and did not actually have time to sit and write down the notes and what followed up after their visit from the patient itself. So they actually outsourced a lot of it back to their own secretaries and to their own back office staff. This was, I think, sometime in 1997, 98, 99. That was the time when India, because of its position of being a very large English-speaking community and understanding a lot of the accents that are involved, took up this whole idea of transcribing and translating the voice records to a written document, which could actually then be sent back. So I think there was a huge boom at that point of time. We had a lot of centers in northern India, around about Delhi, Noida. Then we had a few in Pune, we had Bangalore, and then of course Hyderabad. At that point of time, the relations that we had actually developed with the customer actually proved to be dependent on the way that we could turn around the documentation. And because we were strategically positioned in terms of the time zones,
at advantage.
Whatever the doctors could do this morning and up to the time that they close, we were able to submit it back to them the next day as soon as they came into their practices. So that offered them a lot of free space and time that they could actually devote to looking after patients. So that was a huge After this, then came the connect with the insurance companies. So, once you actually get the medical records into your own records and into your own documentation, what next? So then you convert that into codes which could be understood by the insurance companies.
Yes.
So the entire value chain, and then you have audit, you have accounts receivable, because see, for every $100 maybe that physician bills, the insurance doesn't really pay up 100%. So they
Sure.
usually come back with queries. They sort of deny a lot of it. So there is denial management. So I think each of these processes, I think we were able to add a lot of value, not only us as a company, but I think as a country, we were able to add a lot of value. A lot more countries actually jumped on this bandwagon. We had countries like Bangladesh, Sri Lanka, Philippines that actually then started becoming competition to the players within India itself. But I think what entailed that we lasted with our relationships was the adherence to quality, the adherence to confidentiality, which is very necessary in this domain. You have to actually gain the trust of your customers. You have to ensure that you're a dependable partner to them ultimately. So from that country of the United States, we actually moved with clients in Canada, North America. Moved to clients in Australia, then to England, a few in Europe.
Okay.
So I think by word of mouth, see, we didn't do too much of publicity, but I think word of mouth really helped.
In fact, the healthcare system in the US was close to collapse a decade ago. I think India saved them a lot in terms of what you said, the early part of the medical transcription, then the coding, then the account receivables, and then of course Medicare, Medicaid, everything was built into it. In US, patient is wheeled into the ER, he's first taken care of. Nobody asks him whether he has an insurance or not, and then comes the part that he doesn't pay up. In terms of how that was managed over the years, what are the changes that you saw in healthcare? Because I remember in one of the companies where I worked earlier, every time an ambulance rolls out from NYPD, the billing used to start in Hyderabad. But I think that things have changed over that time. You're talking of 2.5 decades ago to where it is right now, and you're talking of use of AI in it. How are the changes happening, man?
So, I mean, when transcription started, I remember every year there were talks of doomsday, and this industry is going to have a sunset pretty soon. But till today, I'd like to also tell you that we still have clients who still do the medical transcription, because that is the basis of converting voice to text.
True.
And though there is a lot of disruption in terms of AI, in terms of a lot of tools that are available, there is still no 100% guarantee that whatever has been converted from voice to the text is 100%, that it can actually go through. So there still has to be a human element that has to oversee it. So that is very critical. So the changes maybe like, maybe if a transcriptionist did say 100 lines or 1,000 lines per day, maybe that now gets to, he's only actually overseeing the quality. So maybe 10,000 lines. So a lot of efficiency and the complexity has actually also though improved or actually enhanced. I think the competency has also improved a lot with the availability of a lot of these tools. Later on, I think about 10 years back, we moved into Scribe, which was something that doctors used glasses like what you're wearing, but that actually gave us, back in India, we were also able to see the patient in real time. We were able to hear what the doctor and the conversation between the doctor and the patient in real time and transcribe in real time. So that offered a lot more scope for, I think, quality enhancement, because then the file would immediately go back to the doctor as soon as the patient left his cabin. And the doctor could just scan and say, yes, everything has been transcribed perfectly. That scribe process actually has now been disrupted a lot by the intervention of AI tools. So what we had human scribes are now being replaced by AI scribes. But for every doctor, we used to have a scribe that would actually scribe the process and the documentation. We also had a backup scribe. Today, maybe scribes can actually do for 10 doctors.
Okay.
So AI has actually helped in that aspect.
In terms of coding, because that's a specialized field, and I remember that there used to be an exam which every
Yes,
coder
yes,
undergoes, and
yes.
then different levels of competence as
Yes,
they
yes.
climb up.
Yes.
That is where the real value is, isn't it,
Very
ma'am?
true, very true.
So can you take us through somebody who doesn't know anything about the field, a youngster watching you today,
Yes.
as to what is that coding all about?
So, if you look at the sort of the developed nations, a lot of their healthcare goes through a very structured format. Unlike in India, actually, you can just go down the lane to a doctor, pay something out of your pocket and get your diagnosis or the prognosis of what exactly you're suffering from. But that is not the case in these developed nations. You will have to be under some sort of an insurance, and otherwise, it becomes extremely expensive for you to deal with the healthcare costs. So, what happens is, as per the insurance, because for them to deal with every doctor across the country, and there could be millions of doctors, the terminology also is, needs to be understood by the insurance providers. So they came up with something called coding or medical codes for every disease and every treatment that is specified. So suppose you have a cardiac issue, and then you come to me, I'm a cardiologist. And after I write my entire prognosis of your problem, I then send it back to a company like mine, which will convert that prognosis into medical codes. Suppose you need a stent, then the stent code will come in. Suppose you need maybe
Surgery there?
not even surgery, but you have interventional tools
Small things, yeah.
like maybe a cardioplasty or something, angioplasty,
Yeah.
or an angiogram or an angiograph. All those things are actually given to a code, because unless you're very specific, maybe an ophthalmology can then get confused with something else that maybe a person doesn't read it properly. But a code is actually very, very specific. So the insurance person actually looks at those codes, looks at the treatment that is associated with that code, and understands whether it's justifiable. See, if you have a cardiac problem, I cannot be sending codes for a kidney problem or for an eye problem. So that there has to be some sort of a justification. So that exactly is what coding is entailed. And I think the persons who are actually converting that health document into a coding document needs to have some sort of a certification. So we need coders that are actually certified. They go through that examination process.
And how often does this exam happen in India?
I think it happens about once or twice a year, if I'm not mistaken. And I think we actually have a lot of certified coders. Initially, companies that we were dealing with really didn't need the certified coders. But then down the line, when competition started growing up, when quality began getting affected, clients then ensured that they demanded that you needed, like for this, account, we need say 10 or 15 certified coders. So that's when I think the requirement also for having certified coders also grew up.
To keep those healthcare systems in US alive, especially the providers, which are basically in layman's language, hospitals that provide a service, revenue cycle management is a very important thing. From the time a patient is admitted, they're checked whether they have an insurance or don't have, and then it goes through a cycle of treatment. And finally, as you said, the insurance company analyzes before that itself and says, okay, we pay you or we don't pay you. Then there's I'm not saying there's an argument, but there is a challenge to it saying that why they should be paid.
That is where we actually come in, because we have a process called accounts receivable and of course denial management. So for every 100 rupees that say a physician practice or a hospital bills to the insurance, I think 9 times out of 10, nothing, not everything comes back. 100% of that billing amount doesn't come back. So that's where we come in, and then we have a team that actually talks back to the insurance agents to understand what actually has not been, has been denied and why it has been denied, and then justify why it needs to be paid back. So we actually improve the billing of hospitals and physician practices. So for say $100, if say a doctor or a physician practice is maybe getting $60, $70, by us intervening and talking to them and ensuring that we close all the loopholes and the gaps, maybe that 60, 70 goes up to $85, $90. So that's again a huge, so denial management and AR plays a huge role in that.
Now, in terms of your revenue that is coming from the US or any other geography, is it based on the revenue earned or is it based
Yes.
on a
So there are
commission basis?
different models. We have something called an FTE base, which is a full-time employee base. So depending on the number of charts, the number of lines that our persons actually are processing. Sometimes it is a percentage of the revenues that we can enable collections for the hospitals or for the physician practices. So different processes have different types of models in terms of pricing.
When I was in the same industry quite a while ago, there used to be GE, there used to be all scripts.
Yes.
All these people had EHRs, the
Yes.
electronic health records.
Yes.
And US, the problem was that each one of them came at a different point in time into the market.
Right.
And naturally, a hospital that has a GE wouldn't talk to a hospital that has
Very true.
all scripts, and that doesn't talk to an insurance company.
Yes.
Now, over the last 5 or 10 years, you can update me on this. Has this kind of been sorted out?
Mostly there is still areas where you have different systems, different back-end tools that are being used. So suppose we actually acquire a new client, client has their own supporting tools which we will need to work upon. So that marrying of technology still has, it is still an area that needs to be worked upon. Also now with the introduction of a lot of AI within these processes, it takes a lot of time for recently we got a contract where we were actually moving into AI, where we do a lot of work on medical imaging, annotation, and those sort of processes. So even for us to be able to work on their technological platform takes some time. So when it sort of differs from client to client, it does take time to actually understand the nuances of it, the nitty-gritty, and then to ensure that we get efficiency and competency and build that up. And of course, then the learning curve becomes much more simpler and faster.
I think it's like almost like the mobile technology that
Yes.
India went into, that India didn't have to go to the
Yes.
legacy systems
Yes.
that US had.
Yes.
And we directly jumped into thing. And because I was also part of that team in Delhi, which
Right.
built the National Health Portal.
Right.
And one part of it, of course, was the electronic health records. The
Yes.
government of India set out the parameters and said,
Yes.
these are the 90 or 80 items that you have to need to in a EHR, and everybody needs to follow it,
Yes.
so that the patient moving from one hospital to another hospital or one
It's
city
much
to another,
easier to transfer your documentation, your records, and the language is actually similar in most of these systems.
Yeah.
So
So in terms of what's happening in India, do you see any Indian clients, or do you have any Indian clients who have asked you?
Unfortunately, we don't have any Indian clients. Somehow we've seen Indian clients are not very, what can I say? They don't really encourage Indian players, and because I remember coming to certain hospital systems, but they would rather partner with somebody in Australia or Europe rather than come to Indian players. So
It's
I think
strange.
that is quite strange. But then, and for us, I think the time that we take to actually acquire a client is much longer in India than it is abroad. And in the US, especially US, Canada, I think word of mouth with previous existing clients holds a huge weightage. And when we talk to a new client and we say that we have these 3 clients that we've been working for quite some time now, I think the onboarding is much more faster and simpler.
You talked about the use of AI in this particular field sector that we have right now in terms of RCMs or other fields associated with it. What exactly is how is the AI evolving? Because it's not a stationary thing. It keeps changing every day for that matter.
Yes.
And in terms of getting people on board in your company, obviously requires also to get people who are specialized in working on those kind of stuff, who can understand what is happening at your client's end. How is all this happening, ma'am?
So a lot of training has to happen, a lot of upskilling has to happen. I think attitudinal change has to happen. People who are so used to one type of a process, of course, see, within our own company, we have multiple processes. So when I think about 4 years back, when we started getting into AI, we had to pull up resources because you don't get them in the open market.
Correct.
Talent is not available in the open market. This is not an area that is actually established and that you have institutions that are actually training, and then you can just hire immediately once you get a project. So in fact, our senior leadership actually had to go through the strenuous part of training themselves, understanding what the future is holding, what types of models will be there, and for them to actually go through certain processes by themselves to understand the pain points. and then start training people below them, the next level of the leadership. So we were able to move within our own teams. We were able to swap them from the existing processes and push them into the newer processes. So we started actually hiring only for the older processes because that is already well established. We have training plans in place, and the entire cycle is much more faster to onboard them into an older process than a newer process. And people who have been with us in the system for the last almost 2.5 decades. In fact, we've got almost all our senior leadership who've been with us from their day one. I mean, when they actually graduated college and came on board, today they've become the CEOs, they've become vice presidents. And I think I should have a shout out to all of them because they still don't consider themselves to be at that CEO or CXO level, because they still roll up their sleeves, get in
Hands-on.
and do the actual dirty work to understand the pain points, and then it's much easier for them to translate that to their own teams and train them up.
You talked about training part of it. I know it's a painful thing to train somebody and then lose them overnight.
Yes.
The industry, naturally, people look for more money, but at a maturity level, they look for more tenure-based stuff. Have you ever thought that India needs, because we have so much of software engineers, we have so much of IT professionals, and hardly 80% of them don't even find a good job.
True.
Now, in a sense, like this is where it is needed. You need somebody to train coders, somebody to train RCM specialists, somebody to train receivables, as you said, in terms of settlement negotiations and all that. How do you think, is the industry working together to do this?
So, unfortunately, when we started off 2.5 decades back, we had a huge training department. And we ended up training, I think, employees not only for our own in-house processes, but a lot of them got poached by all our competition. So though we went in and had poaching, non-poaching agreements and all that, it was just it was just on the table. It actually, in spirit, nobody implemented it. A lot of training institutes did crop up, but the quality of the training was not that up to mark, because we had live projects where we could actually train our employees. We ended up paying them stipends, whereas for a person who actually wanted to train outside, they had to pay a fee. So there was discussion in the earlier part where should we start charging for training, because ultimately these people are getting poached.
Yeah. And they are on the bench for a long time.
But then I think, no, we didn't take that decision. We didn't go that route. We continue to train. We continue to pay them stipend. They continue to get poached. But then I think we've developed an extremely good, a recognition that people who are trained at Elico are really top of the class.
So you have that stamp.
Yes, and the quality. And a lot of them actually, though they have actually gone into other companies, quite some time they've worked there, but they've actually chosen to come back also because they've understood that our management philosophy and the value that we bring to our employees is much different.
And what you're seeing is also the fact that with President making the noises about, H1B stuff, and other things also, like for example, in UK, it's all under NHS.
Yes.
There are different healthcare models in different parts of the world. India has a different model altogether. For us, out-of-pocket expenses is more than insurance companies.
Yes.
When you look at the totality of it and the way President is doing, and there is a huge disruption there also, do you think a lot of these things which are now presently happening in countries where it is expensive to maintain, like the US, for example, will come back to India and to companies like you?
That's actually quite a difficult question to answer today, because every day things are changing, and they're changing so fast that even before you understand maybe an order that has been signed yesterday, things might change today or tomorrow. But I think I see a lot more advantage that we as a country might have. Because, see, the Western world, or can I say the progressive countries, have also always enjoyed the upper hand. But today, I think with the growing talent that the South Bloc has, and the power that we are bringing to the table in terms of global, whether it's politics, whether it's global economics, I think they are trying to understand that they are no longer most important, and the world is no longer listening to them. So these are, I think, measures that they are trying to again bring back that lost glory. But unfortunately, time has come that those so-called superpowers are on the decline. And emerging countries, of course, like India, definitely will stand to gain. Opportunities are huge. I think the only thing that we will have to do as a country is to ensure that now we put in strict frameworks that will help us. Because until now, we are always been looking outside. We've always looked at exports. We've always looked at that component to actually add to our economy. But our domestic economy is a huge, contributor, and we should start giving more value to our own people.
That he says Atmanirbharta,
Yes.
that is there.
Yes.
In terms of looking at the future of Elico, you have grown from where you are in the last. Is there a prediction by your senior management that look, we will add up 10%, 20%, 25% growth over the next 5 years? I'm not going beyond 5 years,
Yes.
because as you said, the world is
Still
changing
very
overnight.
difficult, yes.
So what are the prediction looking like for business?
So see, we are here to stay, and we are pretty agile in terms of understanding marketing trends and in terms of trends that are actually dominating the sector. So we will definitely have that mindset where not only us, the promoters and the top management, the senior leadership, everybody actually contributes towards strategy of this organization. And we have a mindset that we listen to everybody. Everybody gets that their part of contribution to how we would like to steer this company ahead. That's the reason why I think 4 years back we moved into AI, and I think I can say for a fact that not too many of our competitors have still moved into that area. Okay. So we are trying to be a little bit step ahead of most of our competition, because ultimately sustainability and consistency is necessary. But you also have to be able to understand what are the future evolving trends and understand if you're going to be relevant there. So, and even till today, even we also have to upskill ourselves. Just because I've reached a certain age, a certain qualification, doesn't mean I can rest on my laurels. So I think every single person has to be very, very adaptable and agile.
Charles Darwin said that.
Yes.
And I'm sure. Thank you very much, Vanitha Datla ji, for speaking to us at HYBIZ, because this is a field that is not well known beyond the people who work in those organizations. But youngsters in India need to learn that there is a world beyond software engineering. There's a world beyond just sitting and doing your codes for somebody. But here is a field which is a very, very specialized one that holds a lot of future, because as long as there are human beings on the planet, yes, they will go to a hospital when they're not well. And when they go, there is a process that the doctors and the nurses and the staff have to undergo. And that is what keeps this business going. Thank you very much for speaking to us.
It's my pleasure. Thank you. As you had mentioned, at Elico, we always do follow the Charles Darwin's adage. I'm not sure of the exact wordings, but I remember it said that if you don't adapt, if you are profitable, you can access the future. But if you are not innovative enough, then you cannot afford the future. So
you need to adapt, keep adapting.
You need to adapt, yes.
Wonderful. Thank you very much. Thank you.
Thank you so much.
Thank you, ma'am. Ladies and gentlemen, that is Vanitha Datla, Vice Chairperson of Elico Healthcare, a company that transcends the entire borders of healthcare and revenue cycle management. And for sure, this is a field that will grow and grow. Because as I said before, as long as there are human beings, they will go to hospital when they are not well. And when that happens, naturally, the business kicks in terms of ensuring that what they went through in the hospital is recorded, their revenue is realized, and of course, they go back home cured. Definitely, there's a message in all this. And hope youngsters who are watching this will understand there is a field like this. Thank you for watching. Jai Hind.